Diagnosing.
Welcome to Stall Side Podcast.
Hey Bart, how you doing today?
I'm good. Happy New Year.
Happy New Year to you too. Yeah, so interesting couple of guests we have on the show today.
We do. We got a couple of the smart guys from Rood and Riddle joining us, and returning guest Katie Garrett coming back. She does a ton of imaging. She's really focused, keeps us in line, keeps our technology up to date. And Dr. Jose Bras, surgeon in Wellington, going to join us and talk about PET scan.
Yeah, this is pretty exciting stuff in that it actually looks at the bone and the turnover, the metabolism of the bone, and it looks like it may be a really interesting way to try to find lesions sooner or ones that are difficult to diagnose by any other means. I mean, it's going to be part of a normal progression of diagnosis. Probably it's not going to be such a good fishing net as a screen, but it's really going to add to what the people do that investigate these things.
Yeah, and it'll be interesting to hear from these guys what they think it could, because there's a lot of high expectations for what this modality can do. I'd love to hear their perspective on where we're at and what we can do with it.
Yeah, and speaking of high expectations, you always meet the ones that are placed on you.
Oh, that's
high
great. Well,
expectations.
I never make my New Year's resolutions, though.
Yeah, I just don't make them so I can't fail.
There you go. I like it. That might be my resolution. No more resolutions.
No more resolutions. So on Stall Side this week, we have Dr. Katie Garrett and we have Dr. Jose Bras talking about PET scans. Dr. Garrett, welcome to Stall Side.
Thank you.
Yeah, so Katie, you're back on the podcast. For those that haven't listened to your first one, tell us a bit about yourself.
So I've been at Rood and Riddle since 2003. I started as a hospital intern and then was an ambulatory intern. Spent some time in the ambulatory department, then did a surgery residency, and really I don't do any surgery. My practice focuses on diagnostic imaging, and that's what I do now.
Yeah, and we keep you pretty busy. It's really added a lot to what we do to have you there taking care of that for us, and it's really improved our ability to get some diagnoses. And we're joined today from Dr. Jose Bras from our Wellington, Florida clinic. How are you doing, Jose?
I'm doing pretty good. Thanks for having me.
Yeah, thanks for joining us today.
Yeah, so tell us a bit about yourself.
I'm originally from Puerto Rico. Grew up with horses my whole life. Went to LSU for my animal science degree. From then, I went to Ohio State University for my vet school. After that, I went and did an internship at Rood and Riddle in Lexington in 2005. After that, I did a second internship at Kansas State University, a surgical residency over there. After finishing my surgical residency, I went back to Kentucky. And I was in Kentucky for a couple of years where I did a little bit of ambulatory and surgeries. And then I had the opportunity to come down to Florida to open and help the practice down in Wellington, Florida.
Yeah, the Wellington practice is expanding a lot. Tell us what's going on there at the moment.
We have a lot of construction going on at the time, which is good. Right now is our season, so we're very busy, but we have a new building that is coming up, and the building is going to be mainly more for imaging. We have the bone scan is going to be there. We're going to have our PET scan is going to be there as well, too. We have the Qualibra CT scan coming as well, too. Overhead x-ray machine and new surgery room that is going to go next to the CT scan, just in case that we have to do any orthopedics that we can put through the CT scan and go straight to the surgery room. So we're very excited about that. Like I said, very busy at the moment. We have Dr. Meg Miller that joined us probably 2 months ago. So we have a lot going on right now. It's the season, which is very good. That's what we're here for.
Yeah, so it's not as large as the clinic space here, but still very well equipped. And I think that's what we're going to talk about just a little bit today, is some of those capacities that we have.
Yeah, absolutely. And you touched on imaging and the expansion of the imaging service down in Wellington, Florida. And we've got you both here today to talk about PET scanning. So fill us in.
So PET scan is, I guess the best way to think about it is it's a combination between a CT scan and a bone scan. So fundamentally, it's the same as a bone scan in the sense that it's a functional imaging modality. So it tells you what the bone is doing. What's the bony metabolism? Is it increased, decreased? How is it different than maybe what it should be in a state of health. So that's very exciting because sometimes we can see changes in the bone's function before we can actually see changes in the bone structure. So, for example, we know that radiographs lag behind what's actually happening in the bone by days to weeks. And so with some of these functional imaging modalities, we can find problems maybe even before they're apparent on a structural imaging modality like a CT or a radiograph. So we have that kind of information, but we also get cross-sectional slices, like with a CT or an MRI. So you can really figure out exactly where the problem is in the bone. Is it in the palmar condyle? It gives you a much greater spatial resolution than just from a bone scan. So if you've seen bone scan images, also known as nuclear scintigraphy, really you get a DP view, so front to back view, and a lateral view, so side to side view. And it kind of almost looks like two different radiographs, but because of that, you get the superimposition of the entire structure on top of itself. So the amount that you can pinpoint where the actual problem is limited. It's just the way the technology is. There's nothing we can do about it. But that's one of the great things about PET scan is we can know much more precisely where the problem is. And then the other nice thing about PET scan is you can actually quantify the amount of abnormal uptake you get. So in addition to just being able to say, okay, wow, that's an abnormal area, that's really hot, you can put a number on it, which means that you can follow it over time and compare this horse to other horses, which is really a little bit more powerful because rather than relying upon, my experience or what I think something looks like, I can say a number and say, oh, okay, this is 3 times what it should be in this horse. So it's a really nice comparison tool. So that's essentially how it works. Does that make sense? Do you have questions?
Yeah, that makes sense. Yeah. So Jose, how does that affect how you practice, right? Like you have this lame horse, or you have this horse you're suspicious has some sort of orthopedic problem. How is the access to PET scanning going to change how you manage those cases?
I think that it's gonna help us. It's another tool that we can use. That's the way that I'm seeing it at the moment. I think that I personally, I'm talking from my experience since you're asking me, it's something that I'm going to learn as we go, and I'm going to learn as we use the equipment. So I still have a lot to learn, but how to answer your question directly, I think that I can just go from the experience that I had with some cases where some diagnostics, you do the nerve blocks and you identify, you could localize, isolate where the problem is. And let's say, for an example, it's in the fetlock area and you blocked it. Now you know that it's in the fetlock. And the next diagnostic that typically most of the veterinarians will do in the ambulatory world, they would just take first x-rays, which is exactly what I do too. You don't see anything on the x-rays, then you might go for the ultrasound. You don't see anything on the ultrasound, then you start scratching your head and say, okay, I know that it blocked there, but I can't see anything. And Dr. Garrett explained it perfectly as far as the x-rays and lagging. It's more kind of real time what's happening at the moment. So since the x-rays didn't give me an answer and the ultrasound didn't give me an answer, what I had left was doing the PET scan. And the PET scan has helped me find the problem that I couldn't identify with the x-rays and the ultrasound. Again, it has to be an specific area that you can concentrate on. So typically, it has to start with the nerve blocks, and then you use that diagnostic tool if your x-rays and your ultrasound don't help you out come out with a diagnosis.
Yeah, Jose is exactly right. I mean, based upon sort of the properties of the radioisotope that we use and the way the scan is done, you can't image the whole horse. I mean, physically, you can only fit the carpus and tarsus distally in the machine. So you can't use this on the hip. It will not fit in the machine, so you can't image it. But you're also a little bit limited by time because the isotope that we use for this decays relatively quickly. So honestly, the maximum that we can do is 4 joints. So this isn't an appropriate screening tool. You really need to know what you're doing so that you can use your time effectively. Yeah,
that's a really good point because like with scintigraphy, sometimes people put them in there and say, where does it light up? But that's exactly the thing that people need to realize, is that no, you must get a regional at least localize things regionally before you put this on top of what you've already done.
Exactly, because the isotope that you use for scintigraphy for bone scan lasts a lot longer. So you do have time to scan the whole horse, and the camera is flat, so you can just put it over different areas of the horse, the pelvis, for example. So that's how they are different. You have a more limited amount of time at your disposal, and you have more limited body parts that you can image.
Yeah.
So what are the other drawbacks, though? Because even if we've localized the area, you're not going to go right to PET scan. You're going to still start with radiographs.
Yeah, I would certainly think so. I mean, I suppose there are a few instances where you might not do that, but I really can't think of an instance where you would use them in isolation from one another. You would always want to pair your PET scan up with sometimes a CT, sometimes radiographs, something like that. And I guess one thing that's important to remember is that so many of these bony injuries are repetitive stress injuries. So things are happening in the bone on, a microscopic level that we can't see radiographically. And that's what this is for, is it picks up that little micro damage that's just sort of slowly accumulating. And that's what this is really good for. So things like palmar condyle lesions in racehorses, or proximal P1 sagittal groove problems in sport horses. So it's the repetitive stress type things that this will really shine in. And you're right, you would start with your radiographs, but then you'd go to this if the radiographs aren't giving you the answer that you want.
So this sounds like relatively new technology. Where did it develop, and how long has it been applied to the equine?
So it's been around in humans for a really long time. I mean, you're probably familiar with it, using a different isotope, but cancer staging in humans looking for metastases. So about 5 years ago at UC Davis, an engineer was kind of looking for a project, and what they did was they took a human brain scanner and tried to figure out if they could actually use this to image the feet of horses. I mean, it was a real kind of light bulb moment. And since then, Matthew Sprier, a professor at UC Davis, I mean, he has really, really pioneered this. I mean, you talk about foresight. He has brought this from an idea that some engineer came up with in a lab to, absolute clinical use that's kind of exploding all over the country. So it's only been around for horses for about 5 years. So, I mean, it really is very exciting.
So old technology, new application then.
Exactly. Exactly. And so the scanner that we use has been designed specifically for horses to be used in standing animals. So that was a development that came out of sort of those first, oh, hey, we can actually do this, but how can we do it without anesthetizing these horses? I mean, they had to come up with the machine, they had to come up with motion correction software. So, I mean, there are some pretty smart people working on this.
So you're saying that it's exploding all over the country. I mean, how many sites is this technology available?
Let's see. So it's available at Santa Anita Park. That was the first clinical installation. And they have a scanner at UC Davis that they actually take to Golden Gate Field. And then there's one at Penn. There's one at the Fairhill Training Center in Maryland. There's, I think, 2 or 3 in or going in Florida. We've got one here. There's another one going in Kentucky. So, it's moving pretty quickly.
And is it mostly, because most of those places you listed are thoroughbred training horses, is that the biggest application for it?
I think that's initially the biggest application for it, but I think that there are lots of ways that it can be useful in sport horses. I think it initially went in at Santa Anita just because they have sort of a specialized imaging center there, and it's an extremely horse-dense area. But I think that it'll be the sort of thing where we're going to end up using it for all different types of horses, because sort of like with MRI, we learned, oh, okay, actually these other kind of horses do get stress-related bone disease, where we sort of only thought it was a mainly racehorse problem before. I mean, this technology allows us to find it in these other types of horses where maybe we weren't as attuned to that diagnosis as we should have been.
You're talking about repetitive stress strain type injuries. Would this have any application in very early osteomyelitis?
Potentially. So that's one thing that I don't know the answer to, but I'm really interested in looking at, and I don't know that anyone has looked at this in foals. I mean, I think that's essentially what we're talking about here. But I'm excited to potentially run some foals through the scanner just to see what we see in those horses where, you know it's this leg, but you can't figure out where in the leg, but you really need to know. So that's something that I'd like to look at, but I don't know of any specific projects looking at that in horses yet.
Yeah, for what I do, that'll be really important because, as you say, you get these foals that come in and they're lame. There's no radiographic changes because, as you correctly say, it lags. And just to be able to find where this nidus is and get after it, because that's just catastrophic. By the time you see the radiographic changes, it can be devastating. So that's pretty exciting for me if that would actually work.
Yeah,
but still limited to tarsus, carpus down, or in foals can we go a little
Maybe
further?
a rifle and a foal.
Maybe. So it's essentially what can you fit in there. And actually the scanner that we have in Lexington can rotate. So the foals can be under anesthesia because, to be perfectly honest, I cannot imagine a foal standing still for, the 3 to 4 minutes it takes to acquire a scan. Yes, there is motion correction, but I mean, we've all met foals. So, potentially I could see, part of the neck. I'll ask me in June.
Yeah.
Okay, that's great.
Jose, your case population is slightly different than it is here. Where do you see this technology having an impact?
Dr. Barbara, and you have good questions, and I wanted to say something, but I didn't want to interrupt. But to answer some of the questions that Katie has as well, too, I think that this could be used in every discipline of horses. It just is going to depend on the veterinarians and what we're looking for. I say that because I have used it down here for, polo ponies. We're using them in jumpers. We have used them on a dressage horse. I have used it on a quarter horse. So I think that it could be used in every discipline. I think that it's going to take what Dr. Garrett just mentioned. It's going to take us doing them and trying them and learning to see what we can get out of this tool. It's going in several places now. Like Dr. Garrett said, there's a couple in Ocala. There's one down here. I took a phone call last week from a nice big hospital in Texas that is looking into acquiring the PET scan, and they're very excited. And they were talking about quarter horses. They were used mainly on quarter horses. They do barrels, reining. I mean, you mentioned it. Those horses are athletes too, and they do a lot of work. And I think that is going to be used in a lot more disciplines that we think. It's just going to take a little bit of time for the people that are doing them and using them just to learn the tool, to learn the diagnostic and use it in our advantage.
Katie, you mentioned earlier about integrating the imaging of one modality like CT plus the PET scan. How does that go together? What's involved in trying to overlay them?
So there's sort of two different ways that you can do this. So if you have another cross-sectional imaging modality of the same horse, like a CT or an MRI, there's actually included software in the PET scanner where you upload the CT or MRI and essentially co-register both of these scans together so that then the computer overlays one on top of the other for you. So it essentially then gives you, another scan that is the combined CT, say, and PET scan, which allows you to say, okay, this is the functional area where we're having increased uptake. What does the structure look like? So you can really, CT is probably a better comparison than an MRI. So you can really say, okay, well, what's the bony density? And you can really scrutinize that area to see what's going on. So that's the best way to do it. But even if you just have radiographs, what you can do is essentially take the PET scan and squash it down into the same sort of squashing down and superimposition you have on a radiograph, and then manually put those over one another. So those honestly are wonderful tools for showing people, because to be perfectly frank, a PET scan can look like a weird blob. Like it looks like a sunset sort of sometimes. And especially if you're showing an owner, it can be a little more difficult for them to relate the sunset to the actual anatomy. So by laying things over top of one another, you can really show them, okay, this is exactly where this is happening. So it's a pretty fantastic teaching tool. But there's, obviously ongoing work with doing different modalities, including PET scan and relating them to one another.
You said that it's a poor screen, like comparing to bone scan, where you can actually, look at everything. But are there any situations where you could focally screen an area on a number of horses?
That is a very controversial question. So I would say right now, and this answer may change in 5 or 10 years when we have additional information, this is potentially an area where things like computer-assisted learning and AI may actually end up playing a role. I mean, I'm certainly not expert in that whatsoever, but I could see this happening, especially because of the quantitative nature of PET scan. But as it stands right now, the challenging part is that what is adaptive normal remodeling for a horse in training and what is maladaptive remodeling for a horse in training, they're different for different horses. So one horse is going to respond just fine to training program X, and another horse, it's going to be too much for that horse, so they're going to have problems. So, the whole Venn diagram thing, you take those two horses, one's okay, one's not. There's a lot of overlap in their PET scan findings. So right now, with the information that we have, I don't think that you could appropriately screen. You would let some horses through that shouldn't be competing, and you would take some horses out of competition inappropriately. So maybe in the future, but I don't think we're at that point where we can use this technology responsibly as a screening tool generally.
So just to remove the veil from that just a little bit, what we're talking about is hopefully being able to pick up horses that are prone to injuries, that are about to have breakdown injuries, correct? That's
exactly right. And to be honest, if we could come up with that tool, I mean, people would be thrilled, and not just racing, but all potential injuries. I mean, that's a little bit of the holy grail from preventing these injuries from happening.
Yes, in the eyes of the public, I think that's very important because there have been periods recently where there's been a lot of injuries. And if there was some predictive thing to say, okay, well, let's pull these horses out before things happen, it would be good. But as you say, this is to some degree very infant technology in respect to the ability to mass screen limited areas. But it's good to know that it's being thought about. Yeah,
I mean, I think people are pretty hopeful. I can't think of anybody who wouldn't want that.
Yeah, exactly. And as far as a lot of imaging modalities are used as screens for sales purposes, do you see this has any possible application for a sales thing? Because intuitively it sounds like, no, this is actually a diagnostic thing, not a screening thing. But
I would say right now, this is even further away from a sales thing where you're looking at horses, like for yearlings who aren't even in training yet. So I don't know, potentially for, a 2-year-old sale, I guess I would say that would probably be comparable to using it for screening of, racehorses for injury and things like that.
Yeah, but you made the point before in that who knows what normal is, right? And then there's just going to be the overlap between normal and pathological. And I mean, how are you going to get enough numbers to know the difference?
It would be a real undertaking. And we might still come out with, it doesn't work for that.
Yeah, the predictive value may not be very good.
Yeah.
So if you're an owner or a veterinarian that doesn't have access to PET scan, what type of case would be ideal to refer that horse, would be worth trailering that horse to a facility that has a PET scan?
So I think, and Jose probably has opinions on this as well, but it's a horse where the lameness is localized to a particular region, so to a fetlock, to a carpus, to a foot, something like that, where the suspicion of bony injury is high. If you think it has a soft tissue injury, PET scan, you can use it for some soft tissue injuries, but honestly, I think your money is probably better spent pursuing a different modality, MRI, for example. So where you're suspecting a bone-related stress injury, those are the very best cases.
Yeah. So in your population, Jose, where do you see this fitting in?
Well, no, the Dr. Garrett explained it good, and I will add to that. It cannot be used as a screening tool. I think that's a mistake, at least for now, until we know, we familiarize ourselves more with the equipment and the machine, but it will be, cannot be used as a screening tool. It has to be used, you got to start with your lameness. Start with your lameness, and you do your nerve block, and you look at the horse. Once you have an idea, where the problem is, I think that's when people can use it. And I think that's where people might use it as a screening tool where they're not doing any nerve blocks or anything like that. And I'm probably going more with the race horses where, they're jogging the horse, they flex the horse, they think that is in the fetlock. Then you just have to put everything together. If you're dealing with you have to look at what horse you're looking at. Signalman, if you're looking at a 2-year-old, a 3-year-old, and you're highly suspicious of, distal cannon bones, bone bruising, and you took the x-rays and you don't see it, then I see why some people will be using it as, oh, just do the fetlock and probably that's what it is. I will always add at the end, I will block the horse. If the horse is lame, block the horse to make sure that what we're looking at is real. It's just like any other diagnostic tool that we use nowadays. And I'm faced with it all the time down here. Oh, we have a pre-purchase. Can you do ultrasounds of the stifles and all suspensories, all 4 suspensories? You can make up stuff. You can see stuff. So I just don't think that it should be used as a screening tool. Are there some people are going to use it as a screening tool? Yes. You just have to work with the case presentation and go from there. And one thing that I want to add before I forget to something that Dr. Garrett mentioned a little bit ago is the quantification, the numbers, the measuring, because one thing that I have learned down here is a lot of people likes to do what they call rechecks, bone scan, or a recheck now that what they're going to call a PET scan, where you're going to have a number where they can see, okay, 2 months ago, this is the amount of uptake that I have. I want to do a recheck, which is what I'm doing on Monday, to see if there's any worsening or any improvement, to see if the horse can go back. So some people will use it down here as a recheck. They do it and they might use it as a recheck. And now that we have those numbers and that quantification and that measurement, I think that that's another way that can be used for some people down here that likes to use it like that. I typically don't recommend, and I don't know if Dr. Garrett does, she's the imaging person, not me, but when I came down here, I was faced with, oh, can we do a recheck bone scan 3 months later just to see how it's doing? And that was kind of new to me. And I don't know if Katie, Dr. Garrett deals with that a lot in Lexington, but down here, I think that the PET scan can be used like that. Once you found the problem and they want some quantification or some type of measurement, I think that the PET scan can be used like that for that too. Correct me if I'm wrong, Dr. Garrett, but that's just...
No, I don't think you're wrong. Yeah, it is. I think we probably use it a little less on a recheck basis, but we certainly have done some. And I will say there have been a couple cases where the horse was getting better and the PET scan wasn't, and those remain confusing to me. I mean, I think that's sort of part of the learning curve. Sometimes, it's great, the case is getting better, the lameness is less, the uptake is less, everything's in sync. But there have definitely been some cases where things aren't in sync and then it's confusing. So I think one thing that's important to think about when you do a recheck is, okay, think of each scenario. What are you going to do with that information in each of those different scenarios? Because if you're not clear on what you're going to do with the information, maybe you should think about why you're running the test.
Yeah, that's exactly right. Only if it's going to change what you do. Well, you mentioned radiographs lag, right? So is it a potential that within some horses, the PET scan changes lag?
Mm-hmm. Yeah, I
just don't know.
Exactly, because it's looking at the bone activity. It is not a lameness meter. So it's not like we can say, oh, okay, if the bone activity is above this, it means they're lame. It's just, it doesn't tell you that. It tells you what the bone is doing. It doesn't tell you how the horse feels about it.
Yeah.
Yeah.
Peter and I would deal with that a little bit more on blood work.
Yeah, absolutely.
So things lag behind, and you have to ask yourself before you run the test. That's a good point. What is this going to mean if it's high, if it's low, if it's...
Well, the other thing is, too, the more tests you run, the more likely there is that one is going to be out of range. Mm-hmm. And that's the classic thing with blood tests is you measure 30 things. There's a high probability at least one's going to be out. But is it clinically significant?
But it's a good point. Putting the whole picture together and not relying too much on one part of your exam.
Yeah. And Jose brought this out too. It's part of a sequence, right? It's not a fishing tool. It's part of a sequence of a rational diagnostic plan.
Exactly. I mean, Jose's pointed it out perfectly. Like, this is about this individual horse. It's not about an average. It's not about their best friend's horse. It's about this horse.
Yeah, and you gotta look at the discipline, what they do, and common things happen commonly, and look for those things. And if you can't find them on the x-rays and the ultrasound, that's when you can use it. And you'll be surprised sometimes. Like I was surprised with that polo pony, that I couldn't figure the horse out, and I blocked him twice. So I was trying to make sure that I was in the right area. And when I couldn't think of anything else, that's when the light bulb went off. And I'm like, you know what? I have the PET scan. I'm going to put it through a PET scan and let's see what that shows you. And I was surprised, it was bone bruising on a polo pony, which I did not expected that, but it was real. And we kept moving forward, and the clients were happy, and they had a diagnosis. And you have to put it together with the clinical picture. It's just like any other diagnostic tool. You have to put it together with the clinical picture. It's just an adjunctive diagnostic tool that helps us. Dr. Garrett said it perfectly. It's not a lameness locator. It's not that. But it's very, for me, I'm very excited. It's very, very helpful. It can be used in a bunch of disciplines down here, and I'm looking forward to put some horses through it to see what we can learn and go from there, and then we go see if we can use it more.
Great.
Excellent.
Yeah, Katie, thanks for coming in to see us again today.
Oh, thanks for having me.
Yeah, it's exciting. I'm excited. There's lots of good stuff that, we don't know its limitations yet. So
we don't.
We drive on, it's young.
Yeah.
Mm-hmm.
And there's some really smart people that'll figure it out.
I'm just excited that potentially there's something to pick up some foal osteomyelitis earlier. And Jose, thanks for joining us from sunny Wellington, Florida, while we're up here. And it's good to see you, and we're really excited about everything you got going on down there.
Well, thanks for having me, and thanks for talking about this. This is something that we all have to talk about it. We all have to discuss it with all the veterinarians. We all have to learn from it a little bit, so that way we all can use it. And as we use it, we will learn, and we will know what it will work for, and we will know what it doesn't work for. So that way we can use it properly.
And that was Stallside for this week. We've been here with Dr. Katie Garrett and Dr. Jose Brass talking about PET scans. See you next time.
Stallside Podcast is brought to you by Rood and Riddle Veterinary Pharmacy. As partners in your animal's healthcare, we strive to bring you the highest quality medications, including custom compounds, that are formulated and produced right here in our pharmacy. Along with medications, we also strive to bring you high quality and relevant information, such as that available here on the podcast. So if you like what you hear and see, be sure to refer us to your friends, and remember to hit that like button and subscribe to our channel. We've done a lot of great episodes already that you may need to catch up on, with more just around the corner. One last reminder, nothing you hear on the podcast should be construed as veterinary advice, which should only come from a veterinarian with whom you have a relationship.